The latest Ontario health data shows the average wait time in ERs was 20 hours before the patient got a bed. People across the country are dealing with record-level wait times when trying to access healthcare services. From emergency rooms to surgical queues, there's a backlog of patients, and things will get a lot worse, according to the head of the Canadian Medical Association. Dr. Katharine Smart is the president of the CMA. Dr. Smart, thanks for coming in today.
Thanks for having me.
You know, you recently warned that the healthcare system is collapsing around us. What do you mean by that? I mean, what does collapse look like right now at the front lines of healthcare?
What I think it means is that Canadians aren't getting healthcare. It's really as simple as that. Our emergency departments are overwhelmed. We've got people waiting sometimes, 18, 24 hours to be seen. Elders sitting on gurneys for days waiting to be admitted to hospital. We're short-staffed. We can't actually get people care. We've got growing backlogs. This means real people waiting sometimes years to have essential surgeries, things that allow them to go to work, be around their families. And then in the backdrop, primary care falling apart even worse than before. Before the pandemic, we already had 5 million Canadians without access to that front door of the healthcare system. That's getting worse by the day. We're seeing more and more people raising the alarm that they can't carry on. They're leaving their family practice. So I think when the healthcare system's really no longer able to provide care to patients in a timely way, that to me means it's starting to collapse.
So are these problems that were caused by COVID or existing problems that were magnified by COVID, or sort of a combination of the two?
I think it's a bit of both. There's no question our healthcare system was very stressed before the pandemic, and we've been talking about that for years, and I think we've heard our politicians talking about it. But we've been living in austerity. We have fewer hospital beds, doctors and nurses per capita than most OECD countries, and then you put that under the pressure cooker of something like a global pandemic, and I think it's not surprising that we're coming out the other end of it really struggling.
So you recently met with the federal health minister, Jean-Yves
That's right.
Duclos. There's a lot of health ministers in Canada, but when you look at the federal level, what's the main thing you'd like to see from Minister Duclos to help the situation right now?
I think what we need is federal leadership to really recognize these challenges that we're seeing across the healthcare system aren't unique to one province or territory. We need that leadership to really define what are the key elements where we need action and where we need that funding to go to solve some of those problems. So I think what we're hoping is that Minister Duclos and his team can help lead that conversation, provide ideas to the provinces, things that can be scaled, things that we can learn from each other, and get us all moving in that same direction.
You talk about leadership, but jurisdiction always comes into this, right? And the division of authority and the funding formulas, and you've also criticized this sort of lack of political will that's out there to fix healthcare. Is that a federal problem? Is that a provincial problem? Is this all levels of government? I mean, where does the blame lie here?
Well, I think it's a shared problem and it's a shared responsibility. And I think that's what matters. This problem is too complex, too expensive for one level of government to solve on their own. And I think that's really the danger here, is that we can have the provincial government blaming the federal government that there's not enough dollars. We can have the federal government saying, well, it's not really our responsibility to deliver healthcare, that's on the provinces. And that just creates this back and forth rather than recognizing this is a shared responsibility. It's a major source of where our tax dollars go. And I think Canadians deserve a functional healthcare system. And we're not going to get there unless all levels of governments are working together.
Do you see the appetite, though, for that kind of collaboration? Like the premiers are going to get together on Vancouver Island in July, and I guarantee you the number one demand will be this massive increase in federal transfers of $28 billion a year to the healthcare system. And it seems, at least publicly, the argument is about that. It's about giving money with no strings to the provinces, and that doesn't feel like leadership and collaboration coming together.
I think we have no choice but to collaborate. I think trying to keep doing the same thing that's not worked in the past is not the way to move forward, and that's how we've always done healthcare, right? There has been no data-driven accountability, no outcomes driving our system. So if that's what we want to keep doing, sure, let's just pour money at the problem. But if we want real solutions, that means we're going to have to see that collaboration. And I think that is the job of our politicians. We've given Canadians the promise of universal health care, and it needs to be delivered. And that doesn't look like waiting for years to get the care that you need.
So back to the front line, you talked a lot about staffing being a challenge. You talked about primary care being a challenge, and you suggested a focus on family medicine should be a key priority. I mean, do you think that's the key thing right now, to make sure people get access to a family doctor or at least a clinic regularly to get that first base level of care?
I think all of these things are really important. You know, it's hard to just pick one because the reality is behind each of these challenges are people suffering with different problems. But I think the family medicine is the foundation of our healthcare system. And our whole healthcare system is designed around that idea that you would have a longitudinal care provider that knows you, knows your issues, and helps you navigate the other parts of the healthcare system. So when that's crumbling, it has downstream impacts on acute care and the rest of our healthcare system. So I think it has to be a key priority, and we have to reimagine what that that looks like so it can get care to patients and also retain the people that provide that type of medicine.
So one of the issues, I mean, staffing has been an issue in healthcare in Canada for a while now. The burnout of COVID has only made things worse. And when it comes to things, for example, like family doctors, a lot of people point to internationally trained physicians who struggle to get the accreditation they need to be able to work in Canada because of the various requirements at provincial levels. How do we move past that as a country to get more doctors trained in other countries practicing a base level of primary care here in the country?
I think that is definitely one of the solutions. We know that there's many people that could be leveraged into our healthcare system that are meeting a lot of obstacles in doing so. It's definitely not going to be the entire solution, but it's something that we should be dealing with. And I think we can do that in a variety of ways. We need to make it more straightforward, the regulatory requirements, how people are certified, the way they're brought into practice. We need to make that easier for people. We need to support people through that process. That's important. And we also need to look at things like national physician licensure. If we had one pan-Canadian standard for all physicians, it would then also be easier to bring internationally trained people into the system in a way that was straightforward and predictable.
Right, because right now each province licenses its
That's
own
right.
physician. So you saying a national licensing body could accelerate this.
That's right.
Do you think there's an appetite for that? I mean, people like to control things, right? This is one of the problems in the health jurisdictions issues. Do you think that the provinces will go for that?
Well, there's a huge appetite amongst medical professionals because there's many things that would do to help us, right? A mobile health workforce can be moved to where they're needed. It can allow locums and coverage in rural places. It can make sure that if one place is in trouble, we can quickly pivot resources there. So we're seeing a huge appetite from physicians. We're having these conversations with the regulatory bodies, and I think people are starting to realize that it's something that would make sense, and it's something that really should be pretty straightforward to do.
You know, for 2 years or so, healthcare was the number one issue in this country because of COVID, because of the pandemic. Access to vaccines, access to treatments, you know, the status of hospital beds. It seems like we've moved past that rather quickly, right? As vaccination rates have gone up and cases have gone down, and we're talking more about wait lines at airports than wait times in hospitals. Do you think the country's just moved on a little bit too quickly from what is happening in the health system in the wake of the worst days of the pandemic?
I think that's always the problem when a crisis is going on for a long time, right? Is people get fatigued hearing about it. And I think that is a worry. And I absolutely agree with you. When people are more outraged about waiting 4 hours in airport security than 3 years for a hip replacement, like we've sort of lost the plot there about what's important. And I think that's why conversations like this are so important. You know, people have an expectation that when they need the healthcare system, it's going to be there. And I think right now people are showing up and realizing, wow, this is not what I was expecting, or it's not showing up for me in the way I thought or for my family member. And I think what we need to do is solve that problem before every Canadian has that experience. And that's why these issues need to stay top of mind.
How do you get that public focus back there? I mean, you know, we're having this conversation now, so this is one way to do it. But I mean, more broadly, people want to move past, you know, doom and gloom conversations about the state of healthcare because that's what they lived for 2 years. How do you get the focus back there and overcome that fatigue you mentioned?
Well, I think it's critical that we make Canadians understand that they can be part of the solution as well. They can work with us in terms of what their priorities are, bringing this message to politicians, helping us redesign a better healthcare system that's going to meet them where they are, an expanded healthcare system that actually can start to deal with some of the complexities that we're seeing so that we can have more health and people can pursue the lives that they want. So I think it's something that every Canadian has a stake in, and we just have to keep reminding people of that, and we have to remind them there's a place for them in the conversation as well.
Okay. Dr. Katharine Smart, thanks for your time.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.